Well, this facility, I believe, offers you a lot more space, high ceilings, good airflow, good for infection prevention and control.
For those that don't realize, this hospital serves a parish of about 150,000 people. From a regional point of view, it is one of two hospitals that is always running a high bed occupancy. Not because of COVID, but even without COVID, we're under pressure here for bed space. So the addition of this field hospital is not just for COVID, but in the long term will be of much benefit to this institution here.
The thing that really excited us about the project was we had actually brought the Weather Haven infrastructure here to Jamaica about 2 years prior to use on one of our own sites. Something that could go up quite simply, be used as a pharmaceutical type laboratory environment, and could go down and move to the next site as we expanded. It became very evident to us as COVID was spreading across the world that the units we were not using here on island might be of use. And so at that time we started talking about, is there a way for us to help with the overflow of COVID patients and help the communities with this situation. As such, we were in a position to be able to, at that time, we said loan the units to the ministry, and I'm very happy to say that we actually are providing this unit, which is up permanently for this community to be able to use on.
We're proud of the investment that we have made here today, that will renown down to the benefit of not only persons from Western Jamaica, but persons from Jamaica on a whole. As mentioned earlier, COVID has changed our way of life. And not only are we committed, Minister, to this project, but we're also committed to set aside revenues, or profits rather, let me not say revenues, because it's a big difference, but profits from our ongoing yearly earnings to participate in more social programs like this by contributing to the development and expansion of Jamaica healthcare, so those who can't afford healthcare can benefit from healthcare in general.
The threat of COVID still exists, and so the field hospital that we have put out here today, 40 beds, and I'm sure we can get a few more beds in there if we need to, is a proactive move to manage treatment. Because even though we are pursuing the living with COVID philosophy or principle, we do appreciate that there are vulnerable segments of our population out there, and we need to be ready to treat with those. In that regard, our doctors, our nurses continue to be on the front line, continue to prepare themselves, and as a government, as a region, we appreciate and understand the pressures on this institution here in Westmoreland and the need to expand the facilities to provide care to those who need it. We were almost overwhelmed here at this facility in the third wave. Indeed, I should say we were overwhelmed. We had people in the corridors. We had people who never had beds. And we coped, we managed, but it would have been much better, more efficient if we had this building behind us. So I think this is an amazing addition. Now, we have 6 such field hospitals in Jamaica based on the COVID experience. This is the 6th one that we're commissioning. And I understand there was an MOU with ARC Systems with both donors for 2 additional ones, I believe, signed way back, maybe a year or 2 ago. We have managed to get one up. We will certainly have discussions on the possibility of others. And we thank them for it. But this particular facility is different. It's different because through the leadership of Eric Clark, who came to me and said, you know, Minister, we mustn't lose the opportunity in the crisis. If we're going to put up a temporary structure and we have an opportunity to make it a permanent structure in the context of the need for an expanded facility, let us find a way to work that in.
At JMCC, one of the things that's extremely important to us is when we come into a country as foreign investors, is that we don't just come in and build a business, but we actually contribute to the communities where our employees work. So we're extremely proud with the team at JMCC to have been a part of this project. We could not have done it without Mr. Perry, who was the member of the Minister of Health who ran this for us, and also the partnership of Mr. Horn and the Honorable Dr. Tufton.
Unlike the other facilities, and we appreciate the others, it is a lot more spacious. Higher ceilings, more airflow, as you will see. And, I appreciate that because, when you're in a facility and you're confined, as COVID does to people, I talk to COVID survivors who tell me that it is one of the most lonely and depressing experience. Because even as good as the nurses are who are close to you, they can't come too close unless it is absolutely necessary. So you're essentially alone. And when you're in an area where you feel claustrophobic, it adds to that depression. Well, this facility, I believe, offers you a lot more space, high ceilings, good airflow, good for infection prevention and control. And I suspect the original thought was that it was a lab for growing things. So you created an ecosystem that allowed for fertile pass-through. Well, we humans who are going to use it, I believe, will benefit from the very same principles. So I want to thank Diana for the donation, and by the way, for making it a permanent donation. Thank her very much for that.